in any way, shape, or form in 2009 and 2010. Thank you, Mr. Chair.
Chair, thanks, gentlemen. Now I recognize the gentleman from Massachusetts, Mr. Kennedy, 5 minutes for questions.
Thank you. Thank you very much, Mr. Chairman. Madam Secretary, thank you very much for being here. You touched on a moment ago that legislation that you said you were eager to work with Democrats and Republicans on. Have you seen any such legislation?
With regard to legislation that would promote and move forward on those three things, the issues of making sure we're expanding that insured population, have not seen things that would work towards that.
Madam Secretary, are you aware of how many bills were passed and signed, bills were passed by the 113th Congress?
I don't know the exact number.
Give or take a few, 931, ballpark, sound about right?
That was 1.5.
Any idea on how many of those bills were signed into law? 296, sound about right? Any idea how many times in my first term in Congress we repealed all or part of the Affordable Care Act? 55 sound about right? Any idea how many times those were signed into law?
None.
Any times, are you aware of how many times we voted on some sort of replacement bill to the Affordable Care Act that we voted to repeal 55 times to provide Americans with quality, affordable access and financial assistance to access the health care that they deserve? None.
I think the number is none.
Okay. I would agree with you. So I think given all of the discussion we've had over the course of the past several hours about contingencies, about other options, and the time that I have been in Congress, over 55 times in my first term, including another time in my second term, to repeal all or part of the Affordable Care Act, and under the time that I've been here, under Republican leadership, to not have a single bill that has seen the House floor to vote on an alternative to provide quality, affordable, accessible health care to millions of Americans. I would respectfully ask, as my colleagues have, for the administration to work with Democrats and Republicans to work on any such legislation should they decide to bring that to the light of day.
And in our budget, I would just like to mention we actually do have a proposal to improve the small business provisions of the Affordable Care Act to try and both simplify and make the tax credits better for small businesses. That's feedback we've received about that, and that is something that is included in our budget.
Now, turning to a couple, I think, hopefully more substantive questions that I could get to with you, Madam Secretary. I was pleased to see that the Democratic CHIP reauthorization bill that the President's budget was included in the President's budget extended the Medicaid primary care payment increase. The rate of increase was that it was initially included in the ACA has been absolutely critical, and for the last 2 years, it's boosted payments to doctors who treat the most vulnerable populations, making access an attainable goal, not just an aspirational target. According to a recent report from the Urban Institute, however, the expiration of that payment bump at the end of last year will result in a Medicaid provider payments that are going to be cut on average of 43% and over 50% in some states. The impact on wait times could be drastic and immediate. I was hoping, Madam Secretary, you might be able to comment on the importance of parity between Medicare and Medicaid payment to our primary care providers, and when they have to choose between seeing some of our most vulnerable populations like seniors, pregnant women, and children, why would there possibly be a reimbursement discrepancy?
So I think as you're indicating why we have proposed the continuation of these payments is because we believe it is making a difference, and it's making a difference to the access and coverage that people are getting in the system. And so we've proposed it as a continuation, and we hope that that's something that the Congress will consider and support.
Thank you. The second topic that I want to touch on today, actually my colleague Mr. Murphy touched on it quite extensively in his comments, but is about substance abuse and mental health. Back in Massachusetts, Madam Secretary, I see communities on the front lines of a growing and extraordinarily devastating opiate abuse crisis, and we're looking to the federal government for some support as prescription drug abuse and the number of heroin overdoses continue to mount. Madam Secretary, I was a prosecutor before I ran for office. I saw the impacts of this on a daily basis, not just in terms of addiction and people needing treatment, but in terms of property crimes, personal crimes, for folks that are looking to try to find a way to get help, but the treatment options just aren't there. There are not enough doctors, there are not enough beds, as Mr. Murphy indicated. There's not enough wraparound services, there's not enough care. And I was hoping that you might be able to touch on the importance of actually creating these incentives through Medicaid largely, which is our largest mental health provider, to actually make sure that not just another grant program, but to make sure the incentives are in place to allow that marketplace to provide that care.
So the bad news is, as you indicate, there were 259 million prescriptions for painkillers, opioids, during 2012. That's more than one per adult in the nation. That's the bad news. The good news is that I believe that there is bipartisan support for us to do something, and I believe that that's both in the executive and legislative branch here in Washington, D.C., as well as with the governors who I met with over the weekend on this issue. I think with regard to payment, it is an important place, but there are three fundamental things that we believe we need to work with the Congress and work with the governors to do. One is in terms of the prescribing. That's at the root of much of the problem. We've seen progress in states like Florida where they are watching the prescribing. The plans that states can put in place to oversee that is an important part, but we have a part two. Second is the issue of things like naloxone and access to those, which I think gets to some of the payment issues. And the third is making sure there's medical treatment. I think that was the third part of what you were mentioning. Those three elements, I think, that's a basic agreed upon, and whether it's Senator Portman and Senator Wyden or Mr. Rogers, or it's across the board, there is bipartisan support because states from Massachusetts to Kentucky and West Virginia, my own home state, are suffering in devastating ways. And the one piece you didn't mention, which is the economic impact. And having come from a large employer like Walmart, what it means in terms of having an employee base that can pass a drug test.
Thank you, Madam Secretary.
Thank you.
Chair. Thanks, gentlemen. Chair will note that we've just been joined by a group of students from the Houston area. The ranking members informed me. You want to say anything, Gene?
Mr. Chairman, I'd just like to recognize a number of our chiropractic students from the Houston area and Dr. Prasad, who actually retired as the president of our chiropractic college in Pasadena, Texas. And I invited them last night because I wanted them to show how healthcare policy is made in the healthcare subcommittee. Thank you, Mr. Chairman.